Recently, I got a ton of requests to check out Cyanide and Happiness. I've never heard of this show before, but I did some research and I guess it's stick figure art to present graphic, dark, and often surreal humor, which has been described as seem to have no taste or boundaries whatsoever. Kinda scared for what we're in for today. Either way, we're tackling it head first and breaking down some of the crazy medical type situations and injuries that happen in this show. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff you see on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
Alrighty, here's your prescription.
Thanks, Doc.
That's real doctor to you.
I get a lot of trolls, haters out there that say, oh, you're not a real doctor. But I have a full-time job that I work in an emergency department. I actually have 2 jobs and I actually work at a 3rd hospital. So I work hard at being a real doctor.
Because don't worry, I'm a real doctor.
If you're ever concerned that a doctor is not who they say they are, you literally can look them up and you would actually be able to find where they went to medical school, where they got their degrees from, what board certification they have.
Anxiety, eh? Well, I've got just the thing. Take 3 mouthfuls of these bad boys. Also some uppers to keep you awake and some downers to level you out.
And I've actually seen that where patients will come in with medications to help the stimulants to get them up. And then I see the same patient have medications to bring them down. It's like, well, why can't you just take no medications and just be normal?
Maybe some hallucinogens in case you get bored. Remember, real doctor here.
Oh, that's not good. Don't ever do that. Now you're seeing a depiction where somebody's just downing all these medications. It's called polypharmacy. And you have no idea what the interactions of these medications are inside the body. You really have to look and see what type of interactions could occur. There are resources online where you can actually put different medications in to see if they're compatible versus if they have adverse reactions to each other.
I don't feel so good.
Upset tummy? Say ah.
Oh, don't. Oh, this is how you kill a patient.
Gram of this, a dime of that, a few pounds of this stuff. Hook that right up. This is the police! Open up!
I commented on a video I've done before where I let people know that there's liquid cocaine at a hospital and people lost their minds. Cocaine is like an anesthetic as well. It also causes vasoconstriction. Think about it. Novocaine, lidocaine, benzocaine. These are all canes, right? So they're all kind of the same family, but they're all anesthetics.
What's happening to him, doctor?
I'm sorry, Mrs. Henry.
Oh man, looks like very cachectic. Very cachectic meaning like very sunken in and lack of tissue and skinny and almost like very sick.
But your husband is suffering from a rare, rapidly advancing form of arthritis in his ribcage. His bones are eroding at an abnormal rate.
There's no such thing as ribs eroding through arthritis. Typically, arthritis occurs at joints. What?
I'm afraid he doesn't have much longer.
Is there anything we can do?
Well, we could do this!
That is so messed up. He just killed him. EKG monitor. What? That is so cruel. What? When somebody dies, there are steps that you have to do to confirm that they're dead. Check your pulse, check for respirations, not just poke somebody in the face with a musical instrument.
Not to be a dick or anything, but your daughter's spine is broken, her body is riddled with blood clots and viruses, and she's got a bunch of tumors in her head. There's nothing more we can do for her.
Wait a minute. Broken spine, viruses, blood clots, tumors. Like, what the heck happened to this poor kid?
How much time does she have left?
Only a tiny while.
Did someone say tiny style?
Tiny style, tiny while. Family members and patients will ask doctors if they have a potentially terminal illness, how much time do they have left? So I'm not a big fan of that. If you tell somebody that they have 6 months to live, they're in their brain is already going to put that in. Okay, I'm going to die in 6 months. Versus tell somebody they're going to live for another 20 years. Maybe the median age of somebody going to die with that disease process is 6 months, but maybe they get 2 years because you gave them more to live for. I think there's a huge lesson to be learned even from physicians. We need to kind of be wary exactly what we say to patients because we do greatly influence potential outcomes. Oh. Cruising on. Look at that. That's really cool. Red blood cells. They look like donuts. And there's a big ball of it, which is probably a blood clot. A little off, but pretty good.
What's this? Her bloodstream. It's cleared up.
This little character is just cruising through the body, just breaking clots up. It's probably related to like thrombolytic type agent.
The viruses, they're vanishing.
Oh, so cool. I love that there's a battle with these bacteriophages and then the viral load is going down. These viruses are infecting and replicating within bacteria, and that's why they're called bacteriophages. Very cool structures. Whoa, everybody. Oh, the back is fixed. And the tumors are removed out of the ear.
Why, your daughter is completely cured.
That's super cool. A lot of times I wish we had super things like that to fix people. But a lot of times treatments that we actually have nowadays for cancer, you're trying to kill any rapid dividing cell, kills the tumor without killing you first, kind of thing.
Now, before I can prescribe you any of these grown-up drugs, I've got to run a few quick tests. Well, that's never a good sign. Do you feel that?
Reflex hammer in the knee, you're actually hitting the patella tendon, which then some people are hyperreflexive or hyporeflexive or normal. You get the classic like boing, you know, kind of thing, and it feels weird. You can actually do that in a lot of different tendons of your body. Okay, come on, doc, you know.
Turn your head and cough.
Totally inappropriate, just shoving your hand to do an exam, basically looking for a hernia. The turn your head is so you don't cough on the doctor. The reason why you cough, it's to increase intra-abdominal pressure to see if there's a defect to where you would have a hernia of small intestine or fat go into the scrotum or just next to it. You probably just punched one of them in the face.
Well, you're not looking too good. I mean, you're lumpy in all the wrong places. Plus, your spine is so crooked, it's a miracle you can even stand. I'm gonna have to give you some of the best drugs we've got.
Oh my gosh.
But a word of caution, these drugs are gonna make you see some weird ass.
Don't know what medications he's gonna give that's gonna make you see weird stuff. Pain medications could sometimes cause you to feel weird and hallucinate a little bit. There isn't a medication out there that doesn't potentially have a side effect. So just something to be aware of.
Scalpel.
All right, we got some music in the OR, it's normal. It looks like they almost used like a 10 or a 15 blade scalpel, and looks like they're taking out the heart. And the heart is still beating a little bit. Now the question ends up being, people are gonna ask is, can the heart beat outside of the body? Typically not after like a beat or two, because it functions based on blood flow as well, even though there's an electrical circuit to it.
Donor heart.
Donor heart is a piece of cake?
Wires.
And a candle.
Wait, what?
Happy birthday. That's so messed up.
Make a wish.
He's got a mask on anyway.
I have no choice.
Oh, that's not sterile. No, that doesn't happen in the operating room.
Hey, Doc. I just want to say thanks for saving my life. You're a miracle worker.
Also, your heart is a cake. Ma.
Oh my God. Can the person survive with the heart outside the body? Yes, as long as their blood is being pumped through a machine that's connected from basically an outflow to an inflow. Now with the COVID-19 pandemic, we actually will use a device basically called ECMO, which is extracorporeal membrane oxygenation, where you actually shunt the blood outside the body and then get it oxygenated, almost like using your lungs, and then bringing it back in. Pretty crazy what we can do. So ECMO is not like your first go-to. It's a last-ditch resort if somebody is basically on their deathbed trying to save their life and trying to buy them time to allow the body to heal itself. This was really funny, very entertaining. I didn't know what I was getting myself into with this Cyanide and Happiness. It's kind of funny, and actually some of the medical scenes are quite accurate. So very entertaining. Let me know what you think. Should I do another one? Let me know. Do you have a favorite TV show or movie that features medical situations that you want me to break down further and explain? Let me know which show or episodes in the comments below, or if I missed any Cyanide and Happiness scenes that I should check out for another video. As always, make sure you subscribe if you want to see more fun videos like this one, and check out my Doctor Reaction series right here to catch up on all the reviews of your favorite TV shows. Thank you so much for watching, and stay healthy, my friends.